to the company we keep. If you are currently in midlife or maybe medically induced menopause, or you know somebody in menopause, maybe your partner, you definitely want to tune into this episode.
Yes, today we have an expert with us, a board certified gynecologist who's dedicated to empowering women through personalized healthcare, including gynecological procedures, regenerative therapies, hormone optimization, and much, much more. So please welcome Dr. Salome Masghati.
Yes, yay!
I said it right.
You said it beautifully. Thank you so much for having me, ladies. Happy to be here.
Absolutely. So tell us a little bit about your background and how you got into this.
So I'm a board certified gynecologist. I did 4 years of OBGYN residency. During that residency, that the residency is what we do after medical school. So we do medical school. I did my medical school in Austria, in Vienna, and I came to the US for residency. And in order to get into residency, I had to do a few years of research. I did a lot of bench research on ovarian cancer, vulvodynia, pelvic pain at UCLA. And then I did my residency, and it was 4 years of training how to take care of women of all ages and doing a combination of clinical work where you work in a clinic, you do a lot of preventative medicine for them, you do pap smears and well woman exams, and within that you have hormone care, and then you have a lot of hospital care where you take care of obstetric patients, you do a lot of GYN surgeries. When the emergency room has emergencies, they call you in, and then you attend to those patients as well. And then you rotate at different departments, but mainly you're focused on OBGYN. And that's women of all ages. And a lot of it was focused on, again, emergency care, surgical care, taking care of women that are pregnant or have gynecologic surgeries that they need. And then I added to that 2 years of fellowship where I specialized in robotic surgery and laparoscopic surgery of endometriosis patients and fibroid patients. So I did a lot of hysterectomies. I did a lot of endometriosis surgeries beyond what a regular OBGYN doctor does. Within that, I always had a focus and interest in hormones, functional medicine as well, and also chronic disease, pelvic pain. Like, what makes these women suffer so much? Why do they develop these fibroids and the endometriosis? When COVID happened, I was right at the end of my fellowship. And I had already found my interest in functional medicine at that time. So during that time, when I finished my fellowship, I also did training for functional medicine. And that meant that I learned further beyond all that training in OBGYN how to help a woman figure out, okay, does she maybe have underlying, toxicities with, underlying mold toxicity, heavy metals. What is her gut health doing? What's her liver doing in terms of metabolizing all of that? So that combined everything. And I started taking care of women more and more, like, not just the surgical care, but also, hey, can I help my PCOS patients, endometriosis patients stay healthy before and after surgery? And then I decided that I didn't want to stay in the hospital system anymore. And then I just ventured in just the functional medicine aspect, and I'm doing more of the telemedicine currently. And in that is also the care of hormones as well. And the way I provide hormone care, and I did multiple trainings, is very specialized titration of hormones with lab checks, and then the integration of all these functional systems of the body. So it's a little bit more than just prescribing someone hormones. It's also understanding how is someone's body processing those hormones and receiving those hormones. And when you combine that with the nutritional status of someone, their liver health, their gut health, you get better results, because a lot of women come to you and it's not just their hormones that are lacking. They also are nutrient deficient. Maybe they have long haul COVID. Maybe they have mast cell issues. Maybe they have, underlying toxicities. So all of that has helped me to create that space for myself. I'm continuously learning. I'm continuously improving what I offer people, but that's where I'm at as of now. So I take care of all kinds of women and try to optimize their health in the ways that are familiar to me.
That's amazing. Actually, so we want to talk about menopause. What is it? Why is it? What's happening to our bodies? Because we're all just sitting here talking about what we're going through and not understanding it. Can
Mhm.
you get deeper into that?
Yeah, historically, we just define menopause by the cessation of menstrual periods, but really it represents a whole shift of metabolic health for a woman and has is really related to her longevity and health span. And that is because as women, our health is inherently correlated with our ovarian health. If our ovaries are working and they're the main producers of estrogen and progesterone, and to a certain degree, and I think the majority of our testosterone production, even though our adrenals play a role, when our ovaries stop working during menopause and we no longer have menstrual cycles, there's a whole shift that happens in our body even before that last menstrual cycle that happens. So that shift already starts slowly in perimenopause. And as we are learning more and more, it affects, someone's metabolic markers like inflammation, their lipid markers, their cardiovascular health, their brain health, their nervous system regulation, their cortisol regulation, their sleep, their digestive system. So a lot of women develop things like digestive issues, bloating, constipation. They can develop indigestion, intolerance to foods. They can develop more mast cell activation, allergies. They can develop more sleep issues. They can develop more mood issues, anxiety. They can develop elevated cholesterol or high cholesterol that they never had before. And it's beyond what genetics do. They can develop insulin resistance, visceral fat deposition, meaning their body composition changes. Suddenly they gain weight that they never had to deal with before. They can lose muscle mass. They can lose the health and elasticity of their bones and their ligaments and their tendons. There's something called musculoskeletal syndrome of menopause. So all these things that we're learning about and people in the functional medicine space have talked about for many years, but it's gaining a lot more traction in the mainstream medicine world as well.
Yeah, we've noticed
I
that. I
see.
mean, I've been following, I'm sorry, I've been following your
Yeah,
account and just really getting so much information. And I just
yeah,
feel like, when you go to the gynecologist, there's not really much being said. I mean, you might get a
yeah,
pamphlet saying you might get vaginal dryness. Um, I mean, the sweats, everyone talks about that, but really not anything else,
Absolutely.
especially your bone health. And a lot of women are
yes,
experiencing joint pain. That was a question that we received.
That's a big
Affect
one.
your
yeah.
joints, and why does it affect your joint? Like, how does menopause really, like, what does it do to your system that could really cause those issues?
And
Yeah,
brain fog, that's another
yes.
one.
Another one.
hmm It starts
Hmm.
with the understanding that we have receptors for these hormones in every organ system of our body. So, really, when these hormones decline, like estrogen, progesterone, testosterone, that affects all body systems. I would say the main players are estrogen and progesterone because they're very inherently tied to our ovaries. We still make some testosterone in our adrenals. The little estrone that we make in fat tissue beyond menopause is really not that helpful for maintaining all these organ systems the way they were, and progesterone is also then deficient fully. And that's because biologically nature is interested in our health when it's related to fertility, but beyond that it kind of lets us down a little bit. So we have to maintain those things on our own, and we can do it in a ways that are very congruent with what nature wanted. Like we can use bioidentical forms of hormones that are not synthetic. They're very similar to what our own body makes. But yes, it is tricking nature a little bit using hormones, because if it were up to nature, all these organ systems would slowly age and decline. And that's not to say that everyone feels this. This happens on the inside and it will take many years. But we have a lot of studies showing that if you start hormone replacement, especially in the younger years when it already happens, those changes in perimenopause, you do extend your lifespan and health span. And so it's not just about living longer, it's about living healthier. So you don't need to be on sleep medication, um, antidepressants, you don't need to be on pain medicine for joint pain, all of that. So to answer your question, why do you experience joint pain? There's many shifts that can happen. One is we have estrogen receptors in our ligaments and tendons and muscles. So when estrogen goes down, we feel the inflammation in those joints. There's also more upregulation on inflammation markers. So generally, just we have more aches and pains. But also, our gut microbiome changes through the lack of the hormones. And that also increases our risk of having something called leaky gut. And that can lead to joint pain as well. So there's multiple factors that play a role. And it's not simple, but just giving someone hormones back can resolve their joint pain. I have many women who come to me, they have frozen shoulder, they have diffuse
Yes,
joint pain, and
it's
then when
another
we
one.
address the hormones and obviously also address the nutrition and the gut and everything, their joint pain resolves. So there's a direct association between the hormones and those symptoms.
And with those hormones, replacing them, we're hearing all this different news of, it can cause cancer, it doesn't cause, I don't know what to believe and what not to believe. I'm actually afraid to go on them.
Yeah.
And
So the hormones had a really, really they were really up and coming in the 70s and 80s and 90s. There were a lot of studies that were done and they were actually very popular. And then what happened is they were so excited about hormones in the medical world. They did a big study called the Women's Health Initiative, and they wanted to show that hormones could prevent cardiovascular events, but they chose the wrong type of people to start them on, and they chose the type of hormones that were not the ones that we use anymore, you know? And so they used synthetic progestins and oral synthetic estrogens that was from pregnant horse urine. And even with those even with those type of hormones that they use, they found that if they gave women just estrogen alone, the breast cancer risk wasn't increased, it was actually lowered. But when they give the synthetic progestins with it, which is a synthetic progesterone type, the women had higher risk, slightly higher risk of breast cancer. We're talking not even that much increase, but comparable to like 3 glasses of wine at night or not sleeping and being a night shift worker, those risks were similar to the ones that the hormones brought on. But it created such a fear that since that study, the prescription of hormones went down. Not for everyone. There were a lot of doctors that were not convinced by the study. They were early caught on that the study was flawed and they didn't let that scare them. And they continued to prescribe hormones, and especially a lot of functional medicine doctors, they used a lot of bioidentical hormones and they never stopped. Like one of my mentors, he never stopped prescribing hormones. He's been doing it for 40 years. He's like, he didn't let that study defer him. But that wasn't the majority of people. And the headlines are so scary. And then the black box warning that was by the FDA labeled that
yes.
just scared women. So women were given even just something as simple as a vaginal estrogen that doesn't even have that much systemic effect. And they were scared off because the black box warning said estrogen is associated with increased risk of breast cancer and, blood.
Mm-hmm.
So you have to understand that a lot of people believe the study was flawed, but the fear happened, and now that's still in people's minds.
Yeah.
And we are trying to approach hormones in a more reasonable manner. That means that we're not going to say that they're going to have the same effect on everyone. Everyone is individually different. But really what we are trying to give you back is what your own body was making. If we do that right, that should really not increase your risk for anything. Can you develop breast cancer on hormones? Yes, you can also develop breast cancers not being on hormones. I have many, when I was in residency and fellowship, I had so many breast cancer patients and they had never taken hormones, but they were, there was no association with that. So there's multiple factors playing into the cancer. When we look at the large studies, and if we use the Women's Health Initiative study, what we draw from this is that estrogen alone didn't even increase the risk of breast cancer. It was the synthetic progestins. So now many people do not prescribe those anymore, and they only use them as plan B or C if someone doesn't tolerate the regular micronized progesterone, which is bioidentical. So I hope that answers your question, that we believe that they are safe and that a woman's baseline risk is what it is. Like if you have dense breast, you are a little bit higher risk of breast cancer to begin with. The hormones should not change that for you. Now that's different if someone then develops breast cancer and they are on hormones. They're going to take them off those hormones, not because we believe that the hormones cause the breast cancer, but because there's a type of breast cancer that's hormone receptor positive, and that can then feed on the hormones, not because the hormones cause the cancer, but when you are on active treatment, they're going to take you off the hormones. So we have to make that distinction. What was the cause versus what could potentially, feed into that? And so that is to answer that question as simply as I can for you.
No, that was great.
Yeah.
And I'm a breast cancer thriver, and that means I'm stage 4. So I am estrogen receptive positive. I'm ER positive, HER negative. So my doctor, I'm finally getting vaginal estrogen prescribed. That's okay. But we have questions. I mean, a lot of the cancer survivors feel like they've been kind of left out. Like everyone's getting so excited about this. Everyone's, getting prescribed this. And where does that leave us? So, as
Yes.
far as someone that has had breast cancer or someone like me, do you think even in small doses it might be safe?
Yeah, so there was a recent article that came out written by oncologists that said that maybe we shouldn't blatantly say no to everyone, that every case needs to be considered on an individual basis. And in order to do so, you need to know someone's, um, grading of the tumor and the stage and how everything went and how long ago the treatment was done and what was exactly done. Like, is breast tissue left or not? Is there any tissue that could still respond to the hormones? In the studies that they did, the recurrence risk was increased on HRT, but then you have to have this very individualized conversation with your doctor to look at, okay, what's your quality of life? What is your risk threshold for yourself personally? And how much would that affect you? And so in that article, they mentioned some tools that can help you calculate your recurrence risk and then have that conversation with your doctor. And that is a conversation you have to have with your hormone doctor and your oncologist together. We cannot, because once you have the breast cancer history, we're not going to exclude the oncologist from that conversation. But I will give you some examples. I have women in my practice that, first of all, a family history does not exclude them from getting hormones. So that's a big, like, yes, you can definitely have hormones. Then I have BRCA positive women that have had, surgeries and they wanna have hormones. Again, that can absolutely be safely done. And I have even breast cancer patients. Now, the ones that I have in my practice, they were early stage. The breast tissue has been removed. There shouldn't be so much hormone responsive tissue left. And they understand it and they want it, right? But let's say you're at more advanced stage, but you still feel like you could benefit for your bone health or your brain health or your sleep. That is an individualized conversation. I can't say that in a very generalized way, but I can say that this conversation is moving towards the right direction. And this recent article was so helpful, and I made a post about it on my Instagram. And I think that, and I will talk more about it, but again, it's a case to case basis, and it's someone's individual risk threshold that they have. Yes. I like to tell women, don't ever live in fear no matter what decision you make.
Yes,
Live in
a good way
alignment
to
with
live.
your decisions. Yes. Mm-hmm.
I have a question for you. You had mentioned endometriosis. I have endometriosis. I've also been menopausal for about 9 years with still having symptoms. Um, does the endometriosis go away, or is it still there?
Yeah, so endometriosis is extra uterine tissue. So even if someone has a hysterectomy and endometriosis could still persist in tissue outside of the uterus, obviously, and endometriosis can recur even beyond menopause if the hormones are given, but that recurrence risk is very low. It's free, like up to 3% in the studies, very low. So it doesn't outweigh the benefits of the hormones. So the consensus for endometriosis is pretty clear. It's not as easy for breast cancer patients because there's different grades and stages and all that and different treatments and whether someone is an active treatment. But for endometriosis, it seems pretty clear HRT is safe to be given.
Okay,
And the benefits would outweigh the risk of recurrence.
right. All right. So we know now that the hormones are good because everybody's telling me it's a game changer. It's a game changer because I'm telling you, I've been living. I was kind of the first one to go through menopause out of a lot of my friends, and I'm still going through it 9 years later. Like, how long does it take?
I
When is
actually
it going to
will
go
make
away?
Good
I will
question.
make, I have made some posts about it and I will make more, but endometriosis patients undergo menopause on average a little bit earlier because the endometriosis
Ah,
itself causes inflammation in the ovaries. And so they have often lower ovarian reserve. What ovarian reserve means is how many eggs you have left, follicles that are going to produce your hormones. And so if you
mm,
have less ovarian reserve, your ovaries are going to probably stop working sooner. And so you're even at higher risk of undergoing menopause earlier. So you need even more hormones on board sooner, right? So it's something that needs to be addressed. And I have endometriosis patients that haven't even fully undergone menopause. that I just give hormones because their ovarian reserve is lower. So even in their 30s and 40s, they're not meeting their hormone needs. And as long as I keep everything in balance and we address also their inflammation, they can tolerate HRT very well. So again, endometriosis patients, doing a hormone replacement is not a no. It's absolutely permitted and encouraged. And I just want you to know, in general, no woman should feel like that someone else is making decisions for them. Like, let's say even like you had the worst kind of endometriosis and the doctor says no, you can advocate for yourself because it's
Yes.
what you want. And I think as doctors, sometimes we don't want too much pushback. So if someone else doesn't want it, I'm not going to push it on them. But if the person is motivated, there hasn't been an instance where I couldn't have made it work for them, because they are motivated. They are not scared. They just want to make things work for them. So you really need, I think what women need is more education so they can advocate for themselves. And when a woman doesn't give up, then she'll always get in the end what she needs. She'll find someone that will match her and that will work with her. And again, there are many amazing doctors out there that are willing to do that. Not everyone is willing, and the regular OBGYN in an insurance practice does not have the time to dive deeper with you. You were talking about how a regular OBGYN doesn't address that. When I was in an insurance system, I was so overwhelmed seeing 30, 35 patients a day, and I had 5 to 10 minutes per person. In those 10 minutes, I had to do their pelvic exam and pap smear and order the mammogram and talk to them about everything, including sexual health and mood. And you just don't have time to get deeper into the hormones. So for me, it's in my type of practice, it's a concierge practice. And that's where I can actually give them the time and attention, and they can address things with me outside of visits, and we can do an individualized titration for them.
I love that. Speaking of sexual health, can you talk a little bit about that? I know there's you deal with vaginal and sexual wellness
Yes.
procedures. What is
Yeah.
that?
You have to make that part of what you offer women because it's a big part of our lives. It's
Yes.
the fun part. And so a lot of things change during midlife where libido can go down, the
Mhm.
sexual sensation can go down, like the sensation in the areas. The
Yes.
dryness doesn't help. So you have to address the dryness. You have to bring up the estrogen levels. You can do that with localized therapy and systemic therapy. And that means that, I'll give you an example. Localized therapy is if you do the estrogen cream and you apply it directly into the vagina. And systemic therapy is if you apply the cream or patch or gel or injections somewhere else. So that brings your systemic levels up, and that generally also helps your vaginal area, but you can also use localized creams. Beyond that, you also have other options to help you with the sensation. For example, a lot of women lose sensation in the nerve areas, and I use a lot of regenerative medicine. Like, for example, I take PRP, that's platelet-rich plasma. I take someone's blood, I spin it, and I can inject that around the clitoral area into the vaginal tissue. And, when I was in residency, everybody poo-pooed that kind of, stuff. And when I did the trainings and I actually applied it for women and I saw that they loved it and it helped them, then I started believing in that. So there's a lot of mindset shift that happened for me as well. There is also laser therapy, that there are like heating devices that can bring more blood flow into the vagina and can help the healthy tissue to restore itself again, the tissue to help and heal. But I think a good start is to at least address the vaginal dryness with a cream, with an estrogen cream, and improve the systemic hormone levels with testosterone replacement, estrogen replacement. Sexual health is a big one, and
Yes.
a lot of women suffer from it. And I think that we need to do better because we've had Viagra on the market for a long time, and for women there wasn't so much out there. And the medications we have for libido, they're not as straightforward as Viagra because
Yes.
women's libido and sexual health is a little bit more complicated than men's. So it has to be addressed from multiple angles for women. Hmm.
And I feel like it's hard because the men don't understand that it's not that we don't want to,
Yeah. Yeah.
love them, but it's that we just physically don't feel don't feel
Yeah.
I
right.
mean,
It's
it's
it's just
painful. It's
not.
very painful. I mean, for me, it
It
was
is.
extremely painful. And I was medically induced. So I didn't even go through perimenopause. I went straight with the Lupron
Mm.
right into menopause without much education. and it was very, very painful.
Yes.
So
I say it's like shard glasses or
no
whatever, glass shards.
exaggeration.
That's what it feels like
Yeah.
sometimes.
And that brings me, Lynn, that brings me to the topic of testosterone for breast cancer patients. There is some data that if someone is on aromatase inhibitors, they can actually be given testosterone without the risk of cancer recurrence, and that would help their libido. And then if you combine it with vaginal estrogen, you can improve your sexual health a lot, even though you're a breast cancer patient. Again, I can't make
Right.
recommendations for you in individual case, but
Right.
there are things you could bring up. There's some data on that, and I think more data would be wonderful. But yeah, when you undergo surgical menopause, it's even more abrupt. It's actually even more traumatic because you
Yeah.
overnight lose all dysfunction and the receptors suddenly are starving, and it's a very abrupt change for you. So yeah, for men to know that it's not them, it's that your desire changes, your libido, you have changes down there with the sensation, you have dryness, but also just generally your libido changes, and both estrogen and testosterone are very important for that libido sensation. There is more to it as well. There is also when stress is dysregulated, the cortisol axis, because that is related to our hormones as well. That can make it harder for women to even like be ready to, enjoy sex and be relaxed. So
Right.
multiple components. I think for someone like who's a breast cancer patient, I would encourage the vaginal lasers, the PRP, testosterone, vaginal estrogen. There's so many things, avenues that even breast cancer patients can go that can help their sexual health.
Oh, that's amazing. And I love the way you talked about advocating, because, the 9 years that I've been living with metastatic breast cancer, just looking up PubMed and really bringing the data to my doctor and saying, hey, look, I read this. So can we try
Yes,
this?
yes.
So I really
I
appreciate
think one of the most famous authors on that is Dr. Avery Blooming with Estrogen Matters, where he worked a lot with cancer patients and he has the
it.
data on a lot of the breast cancer patients. So I think, and he himself finds it that with colleagues, he's often not, heard, or always his views are not always accepted. So it's not to say that you're not going to get pushback, but in general, if you're determined, you will find the right provider for you and you will be heard. You just can't give up if the first or second person are not as receptive to it. I think we're going to move away more and more from that system of the hierarchy of the doctor tells you what to do and there is no
Yeah.
conversation. Really, informed consent means that I laid out for you and I let you make the decision. And sometimes it helps if you hear it from multiple people, if you're
Right.
Yeah.
here. But if you're fearless, anyways, nothing will stop you because you will get what you want.
Well, when
You
my
will.
doctor
Yeah.
says no, I get a second opinion. And now I hear
Exactly.
Mhm.
two doctors giving their opinion, and then I feel like, okay, now I can make my own opinion.
That that's a good way to go about it. And thank God, I mean, in this modern world, we have a lot of help through, we have the social media and other voices that can be heard as well. So it's great.
Yeah.
And I mean, functional medicine and just in general, I think, is seeing the whole patient, right? So, seeing people like you coming along and I think it's just great to, that you can, like I said, the whole person and not just like, oh, go see a specialist. Oh, you're having a problem with
Right.
that? Then you go to the gynecologist. Oh, you're having a
Yes.
problem with your bones and go see this other doctor, and it's like all
Yes.
in one, which I think is amazing.
Yeah, and
Yeah.
and I think it can still be a confusing world when it comes to hormones for even the regular patient. Forget being complicated, being a breast cancer patient or endometriosis patient, but even for the
Mhm.
regular patient, there are many people who struggle even though they find someone who prescribes them hormone. And I want to touch on that as well. Just
Yes.
getting hormones is not always all you need. Maybe it's also the dosing of the hormones. So we have studies that show
Mm.
that if you're being prescribed a standard patch, we don't all absorb it the same way, so maybe the levels in our blood are not always going to reach the levels that we want to actually have optimal bone protection, and that's what we can measure, and we have good studies on that. And so it really comes down to maybe just getting started, but maybe if you want to be optimized, you really need someone who knows how to follow your labs as well and
Yeah.
titrate things for you. Yeah.
I agree. And then the PRP, you
Mhm.
said it also improves your joint pain. Can you tell me a little bit about that?
Yeah, so in the practice that I am, I also love PRP injections for joints if they are inflamed. I always address the diet, the lifestyle, and we talk about the type of movement that exacerbated the pain. But if it's localized joint pain, it's not just diffuse, that's more related to overall inflammation. Um, Sometimes we can use regenerative therapies like, fat stem cells or PRP from the persons themselves and then inject it into these areas. And that can help regenerate the tissue, lower the pain, and then it would help these people not to be dependent on pain medication or surgeries. Because surgical outcomes are not always positive, and pain medicine is not something you want to be hooked on. So if you can find ways to but avoid that, then you have more longevity with that, because those procedures have better outcomes for you and they have fewer side effects. And that's something that I do offer in the practice where I am as well. And I'm also going to dive a little bit more into rejuvenation of the ovaries and seeing what options there are for that, because
Yes.
many women want to still delay their ovarian aging, and there are things that we can do for that. I believe that the reason many people are why we have so many endometriosis patients, so many mast cell issues, so many people with earlier onset of menopause is because
Yeah.
potentially there is disruptors in our hormone system that we are exposed to, and that can include toxins from endocrine disruptors. These are chemicals, microplastics that can actually deposit themselves in our ovaries and in our testicles and affect hormone levels in both men and women. They can deposit themselves in fat tissue, in breast tissue. So if I can help women detect that, maybe help them make healthier choices, maybe implement certain things that can help them get rid of certain toxins. We have good data on heavy metal detoxification helping hormone health as well. So it depends on the context for a woman, but an ideal workup would be, hey, you let me test you for microplastics, heavy metals, you let me test you for underlying
Mhm.
infections and your gut health, and I can address all of that. And we might be able, and also by addressing your stress levels and all of that, we might be able to maybe delay the aging of your ovaries a little bit. And then, and there is maybe some data that we could also help the ovaries be rejuvenated by injecting your own body stem cells into them. But there's still a lot of research to be done. There is no definitive answers to this. But I think anecdotally, we have seen some improvement for women. There's no guarantee that it's going to delay things, but at least you live as healthily as you can, as long as you can. And I'm a big supporter of all those things and the hormones. Like it's not one or the other. It's not black and white. I think it's a spectrum of everything, and everyone is different and everyone needs different things. So I think it's just great that we have access to this testing and to these options for women. We live in a good time,
Absolutely.
but it's just good for women to know that there's options for them out there. Yes.
And you do a customized approach with your business.
Yes.
So, and I think that's so important because when you're going through all this, first of all, we think we're going crazy.
Yes.
100%. Everybody I spoke to, they're like, there's something wrong with me, my hormones, I'm mad, I'm upset, I'm this, I'm that. Everybody thinks they're going crazy. But, to come to you, I feel like the way you just explained everything is that we're not going crazy and we can do something about it.
Yes.
And that's what's important.
And I think that's
No, the
changing, right?
changes are
I
real.
mean, I feel like all of a sudden it's like a resurgence. Like, were we just not talking about it? Was there some reason we weren't doing all the research or even talking about it?
Yes.
Like, what's up with that? Was it like taboo
I
for
know.
women to say, like, oh, I'm going through these changes, I'm getting older? Like, what do you
No,
think?
great points, both of you. And I think there's absolute truth to that, maybe it would have been great not to miss out all those years of looking deeper, but we're there now. And I think the wave is coming back towards being more welcoming towards hormones and just talking these topics and understanding how it affects multiple different organ systems in a woman's health and how her health is related inherently to her ovarian health. I think that's really important. Yes.
I agree.
Hmm.
And it's hard to as we're aging to begin with to age, but now you're throwing all this other stuff on us. And it's like, what do we do? But it's so good to have somebody like yourself to come in and say there's things that, we can do to help you manage your life and feel better about yourself. So I
Yeah.
appreciate that.
And I think that, women themselves can go through a lot of shifts. There are multiple times in their life that there is these big shifts, like, teenage years, you have the big shift of hormones coming in. Then you have your maybe pregnancy if you had babies, and then the postpartum period, and then
Yeah.
perimenopause. And in none of those shifts, like, does anybody explain how overwhelming that can be to go through these changes? And so I think just talking more and more about that is so helpful for people. Something as simple as, hey, if you're in postpartum and you have some menopausal symptoms, yeah, we can even help you with
Mm.
that. Or if
Right.
you want to optimize your pregnancy, maybe let's look at your hormonal health as early as possible. Make sure your ovaries are working well, your body's healthy, like just so many things. If you're younger and you're having really heavy, painful periods, you shouldn't suffer in silence. We should already address
Yes.
it when you're 18 years old or 25 years old. Why do we have so many young women with painful periods? It
I
is
know.
not normal that so many people are suffering. A
Yes.
healthy period, and that's why I keep talking about periods on my Instagram. I don't
Mhm.
get as much understanding because my followers only want to hear about hormones, and I bring up
Right.
regular periods, and they're like, "What is she talking about?" But it's because through the periods we understand so much about our hormones, and our periods are in a perfect rhythm when they're balanced. And a lot of people don't even have that in their younger years because we're bombarded by toxins and things that affect us. And then if we use oral birth control, we just disrupt the natural rhythms. And it's not to say you shouldn't use birth control, but just understand what it does to your body. So
Yeah.
you are spending all these years not understanding your natural rhythms and what your body should feel like. So that, Gina, for example, you had endometriosis, like, it's not normal to suffer and being cowered over
Yes.
at 18 years old or 25 years old. Like, we should address that
100%.
as soon as possible, as early as possible. Don't wait until menopause to like address hormone health. So
Yeah.
I think a lot of the things I was talking about, people can address sooner for their health, And then, so often I have menopausal patients, and then they want me to see their daughters too, because they're like, well, you also understand periods. So can we talk about her period?
Yes.
Yeah.
Well, that's how I feel with my daughter because I mean, I suffered through endometriosis. I had two laparoscopies before I ended up having children. And the first one I was 24, and my daughter who's 22 is, I think she's even worse than I am right now, than I was at that age. And her periods are terrible, and it's just it scares me because she's already at a point where she's feeling it in her back. She feels it in places that, you know I never did. So now I'm getting worried, like, does she need to go get checked,
Yeah,
for
and there's data that the longer they live with that pain and the pelvic pain, what happens to the brain is the brain becomes sensitized and the pathways of pain perception change. And then these younger women are more prone to developing than other issues that are related with pain and nervous system
Mm,
dysregulation too. And so that even if they, for example, get surgery and they find endometriosis, the pain pathways have been primed and they continue. So it's just it then become a chronic issue. So I think the sooner someone addresses period issues, the better. The period is a vital sign to a woman, and it shouldn't be extremely painful and it shouldn't be extremely heavy. If it is very heavy, where you soak a liner or a tampon more than every 2 hours, that's not normal. If it's
right.
so painful that it's 7 or 8 out of 10 pain,
Yeah.
it's not normal. You should have mild cramping, yeah, that's normal, but you shouldn't be covered over, miss work, miss school, throw
Yes.
up, land in the emergency
Yes.
room, have excruciating migraines. Then there's
Mhm.
already a disruption in your natural hormone signaling. And I believe, and this conversation is not being had enough yet. I think that will
Yes.
be talked about more in the future. I'm trying to just be a little bit more on the forefront of it. I believe that if we address this earlier on, you experience a better perimenopause and menopause as well. Because now I'm
Interesting.
optimizing your hormones earlier on so that you're not suffering, those pain pathways are not primed. And again, if you're, for example, an endometriosis patient, even at 25, you could be lacking certain hormones that can affect your bone density, your brain health, your heart health. We know that women with endometriosis have higher risk for cardiovascular health. Well, is it because generally there's so much more inflammation in the body? Yes, absolutely. But also because probably there's
Mm.
also hormonal imbalances to begin with. So there's a lot of things that make it more complicated for people that have PCOS, endometriosis,
Yes.
irregular periods, painful periods, very heavy periods, fibroids. So you just need to address those hormone issues earlier on. What can everyone do at home? Start with a healthier lifestyle. Like, try to avoid too many toxins in your environment. Everybody talks about how perfumes are endocrine disruptors. I had no idea when I was in my 20s. I wish I had Instagram when I was in my 20s. It can be information overload, but you learn a lot, right? Like perfumes and scented
I
candles.
didn't even know that.
No, I didn't know that. I didn't know that when I was in my 20s. And then alcohol can be really hard on your liver. Maybe moderate yourself. Processed sugar. You can already start a healthier lifestyle by incorporating vegetables, Mediterranean type of diet with some fish, lean meats, but grass fed. Make sure that you look into your gut health already. Exercise, keep your body leaner because excess body fat creates more inflammation or insulin resistance.
Mm.
um, Look at what you put into your body, how you digest, how you eat. Avoid too much toxic makeup or endocrine disruptors like scented candles. So much that we could teach younger people already so they don't have to suffer so much. And then when they undergo perimenopause, it's not as hard on their bodies. And I really believe that multiple things have happened in the last few decades that have made those transitions harder for people. Like, we have more endometriosis than before, we have more menopause
Yes.
than before, we have women are suffering a lot more through perimenopause. And I do think that COVID didn't help, endocrine disruptors don't help. Like, there's so much playing a role in this. So, yeah.
Well, yeah, I mean, just the education alone with fragrance, like you were talking about candles,
Yes.
you could look for
Hmm.
ingredients. I think if it says fragrance or something like that, even in
Yeah.
foods, if it says flavors, that means it's not real.
Yeah, try when you're younger, try to maybe eat your mom's food or make food at home. Don't always
Yeah.
eat out. Don't eat the seed oils and all the processed food. I will
Yeah.
tell you, I have women who tell me the moment they eat out, they're bloated for the whole day or they
Yes.
feel so inflamed. It's not in our heads. These are true things. I
Yeah.
think that our food supply, what we, our lifestyle, people are more stressed than ever too. And
True.
stress creates a lot of dysregulation of our vagus nerve, which is the calming nerve. And so we're all in fight or flight as well. So just learning early on stress management, staying maybe off too much social media, maybe not drinking too much alcohol, binge drinking. Maybe I'm not going to have all this ice cream and the chips, and maybe I'm going to eat some vegetables. Just incorporating this healthier lifestyle earlier on will make a whole lot difference for a lot of women.
Absolutely. Well, thank you so much. I mean, you've been a wealth of knowledge. I know our listeners are going to
Yes.
really appreciate that. And I know your Instagram because I follow you and I learned so much. But how can people find you? And even come to see you?
Yeah, so I'm in Florida in the Clearwater area. We have a little IV clinic here where we do the PRPs and all that. It's called Orthomolecular Nutrition. It's not my clinic, but I work there and it's family run and it's wonderful. And then I have a telemedicine practice. But I think, just following me on Instagram, maybe getting some information because obviously I'm not licensed in every state. I am I have a wait list for bookings. But I want to help people by just spreading information. So people can follow me on Dr. Salome Masghati, MD, on Instagram, and I try to share information. And again, I love learning from people's experiences. So if you follow me and you want to comment and share about what has helped you, or if you want me to talk about a certain topic, you can comment on Instagram. And I always try to talk about certain things if I can get to it. But yeah, it's my pleasure to spread information as much as I can and spread the knowledge.
Well, I have one more question for you since this is, the company that we keep. Who in your life, you know, got you to a point where you are today or help you on an everyday basis?
I would say my best friend is my mom. She's probably the wisest person I know. And I can only dream of being as sweet and giving and loving as she is. I would say she's the most amazing person in my life.
Oh, that's beautiful. I love that.
And I started her on HRT even though she was in her 60s, and they had stopped her because, in Austria, they say, oh, we give you HRT for 5 years and we stop it. And we now know that we don't have to stop. And so I
Oh,
started her
okay.
again after a 5 year break. So, yeah.
And now you can do it into your 60s, 70s?
Yeah, so there are some studies showing that there's safety even if you continue that. And I have many women, and even when I worked with my mentor who has been having a thriving hormone practice for 20 years, and he never stopped prescribing during the WHI time as well. He has women in their 70s and 80s. They will never give up their hormones. And there's no reason to stop if you're doing well. So, yeah.
Well, we're gonna have to have you on again so we can just like continue to talk. You have such a wealth of knowledge and you have so much to talk about. So there's definitely another topic we're gonna have to do this a part two.
Thank you, ladies. I'm so
Thank you
happy
so
that
much.
it was helpful. I appreciate it.
Yeah,
Absolutely. We learned so much
incredible.
from you today. So thank you very much for being here.
You're very welcome.
And if you'd like to be a guest on our show, please send us an email and let us know why you would like to come on the show and what you would be sharing with us. All right. Thank
Yep.
you. Bye.
Thank you,
Yeah.
ladies. Have a good
Bye.
afternoon. Bye bye.